Hi friends, welcome to today's video on NABH 6th edition AAC chapter SS assessment and continuity of care, second objective, second standards and fourth objective element. It states that the written guidance also address managing patient during non-availability of the bed. The organization should have a documented policy and it should be implemented for the safe process or during the non-availability of the bed. When the organization is not having the bed and the all beds are full in the organization, it may be ICU, it may be the emergency, it may be the IP ward, inpatient ward beds. So during that period, what the organization will do? So the organization will refer the patient to the another organization and shift the patient to the another organization, and what and all procedure needs to be followed, that should be documented as a policy and should be followed by the organization. What is the requirement of NABH? Requirement of NABH is policy should be there for the non-availability of bed. The policy should include the temporary holding point if the hospital is having the temporary holding point, and how much time they can hold a patient in the temporary holding point, that should be defined in the policy. Sometime organization used to write the temporary holding point like emergency department or daycare is the temporary holding point, but there is no equipment availability or there is no facility, so that is not your temporary holding point. If you are having showing any temporary holding point, then that area should be properly equipped to manage the patient. If you are showing that ICU patient you are going to keep in HDU, then all arrangements should be there. Your step down should be there. If you are showing that emergency beds are full, then you are going to take the emergency patient in daycare, then daycare also emergency requirement should be there, availability should be there in the daycare. So the wherever the temporary holding point you are creating there, all the requirements to manage the patient, to save the patient, should be available, and how much time you are going to keep, that should be defined in your policy. Organization will show the area, they will write the policy, but they will forget to define in their policy the time period, how much time they are going to hold the patient, where they are getting NC during NABH, because NABH is straightly telling that you should have the time period, that how much time you are going to keep the patient in the temporary holding point. Why it is required? The patient safety and continuity of care should ongoing, this is the requirement of NABH. And if your all the beds are full, you should have a MOU with other organization for transferring the patient. So you should have one MOU with your nearby hospitals or your sister concern hospitals. Whenever your beds are full, you will be shifting the patient to that hospital. So one or two hospital, you as per your community requirement, you should have the one or two hospital MOU. If this hospital also will be full that time, the another hospital should be there in your hand to shift the patient. And your policies should be based on like non-availability of bed, of in ICU, in ward, in emergency. So every category wise bed non-availability policy should be defined, and who will handle the patient during the non-availability of bed of policy, who will transfer, how it will be transferred, that also NABH policy needs to be followed. And organizations should have the temporary holding point also and should be properly equipped with to manage the patient. Non-availability bed policies should include the purpose of the non-availability, scope, policy for general bed, semi-private, emergency bed, ICU beds, then roles and responsibility of staff. Which staff will do what? That should be written in the policy, and distribution and review, where and all the policy is applicable, available, and when is the review, next review. All policies should be reviewed yearly once, or you can do your organization policy like 2 year once. It depends upon your organization how frequently. Some policy NABH only is telling like your infection control policy, your quality manual, these patient safety manual, these are required to be yearly once. It should be reviewed. But other policies, yeah, you can make your policy like 2 years once you will review or 1 year once, but yearly once. But every policy should be reviewed in the defined timeline. Or you are having any changes, then your policy also should be changed. Policy should be approved by the management. Any policy you do, that should be approved by your management, by your medical director or by your CEO, whoever is in your top management, this should approve. Thank you. If you like the video, please subscribe my channel for more informative videos. Thank you.